I'm Shelley Weber-Tompkins, and I am here to bring you another segment about PCOS and how it can sometimes cause pain when you're trying to get pregnant, and you may or may not know you have it. But here's some signs and symptoms I'm going to go over with you today. And so, lesser known facts about PCOS and painful periods. And so I talked a bit last time. If you missed my first recording, you can see what I mentioned about PCOS then. Now I'm kind of giving you more of what happens a lot of times that can cause painful periods. And next time, the last part of PCOS, I will have more information about what you can do dietarily and supplementally, depending on what symptoms are showing up, okay? So to start with, one thing that is actually a supplement that it's a mineral that gets depleted really rapidly in our bodies with or without PCOS. But especially with PCOS, our body really does need more magnesium. And so with magnesium deficiency, if you do have PCOS and you know it, 320, I would say, to 400 milligrams daily. And when you're trying to get pregnant, most people are on prenatal, so you want to check your prenatal and just see if it has enough magnesium. Some of them don't have any, so you may have to add additional to it. Some magnesiums they're not all created equal. You have to look for fillers in there and make sure they don't have any, or if they do, it's very little. And mainly the types, the binders. And so a binder would be, it's magnesium oxide, which is one like citrate that often are really good for use when you have constipation. So if your bowels are really bound up, those are usually ones you'll find when you're trying to move those along. But otherwise, when you're trying to help your liver work better, which is a big part of what converts hormones, then a taurate can be really good. A magnesium taurate, glycinate, magnesium glycinate helps get more of the magnesium into your cells. Magnesium malate, which can also help with your muscles, getting more of the magnesium into those, especially when you're having cramping pain. So I usually use one that has all the above. There's some you can find out there that will have all the different binders for magnesium, so they'll go to all the different areas of the bodies that need it. Magnesium is really important for all of us because there's so many things that deplete it, and there's so many bodily processes that require it. Okay, so that's one. But with pain, when it's deficient, magnesium can definitely cause more muscle pain, which is what the cramping is. Secondly, prostaglandin imbalance is a very common thread with PCOS. And so we want to look at the fact that when prostaglandins are high, it increases inflammation, and that higher inflammation can cause severe cramping. So we're looking at that too as another factor that can cause pain with your menses, and maybe even other times of the month, like when you're around your ovulation, you can also have pain when you have PCOS because you're getting so many different cystic conditions that can go on there. And with the inflammation added to it, it can be quite uncomfortable. Okay, I mentioned this last time, the endometrial thickness. If you're having really intermittent periods where you don't know when they're going to happen, maybe they're 3 months apart, then you have more endometrial thickness that can occur. And so then when you do have a period, moving that kind of thicker tissue through, and maybe with more clotting factors, it's going to be more uncomfortable, cause more pain. Pelvic floor dysfunction is another thing that can happen because of hormone imbalance causing more tension in those muscles. So you may also experience that too. So it can make several things unpleasant, whether you're trying to have a period, whether you're trying to ovulate, maybe even if you're trying to have sexual relations. So the pelvic floor dysfunction, and that's something that you can work on if you go to a pelvic floor specialist. They can also help with that. But a lot of these are going to be made better too when you change your diet and be really good about it. So you're eliminating some of those inflammatory foods that we'll talk about next time. And then also taking the supplements that are really good for helping to reduce inflammation and regulate hormones. And the other thing I talked about last time also is insulin resistance, which we're coming up on in a minute. So after pelvic floor dysfunction, the tension from hormone imbalance, we're looking at liver congestion. And the liver has so many jobs, tremendous amount of jobs in the body. And we don't take nearly enough good care of it. And so in this case, in Chinese medicine, which I do, I'm an acupuncturist as well as a functional medicine practitioner. I'm certified in both. And with liver, we look at that a lot in Chinese medicine as when your liver is not able to do its job well, that it will cause more stagnation or stagnant energy to occur. And that can also be frustration, is what that can feel like. But it also can cause pain and discomfort in this area. And you may not know it's that uncomfortable unless you're pressing around in there. But when the liver is not able to function as well, it's going to impact your hormones. There's a lot of things it can impact because it's so pivotal with what it has to do in the body. It's a detoxifier, but it does so much more than that. Okay, so we need to make our livers happy. And so that's a lot about diet too, is getting rid of anything that's going to be impacting your liver more when you're trying to get pregnant. So if you're drinking, you need to cut that out. And even like minimal drinking for some people is going to be too much. And so if you're really trying to conceive, you want to make sure you're eliminating anything that's going to get in the way. Okay. Ovarian cysts, that's kind of a given a lot of times with PCOS, depending if you have the type where it really is excessive amounts of cyst. And the pain can come from just, like I said before, the sizable amounts of them, but it can also come from them rupturing. That can be very painful. It is very painful. So that's another area that if you're having that kind of pain every month and you haven't been diagnosed yet, which an ultrasound can be very helpful there, as well as checking your hormones. Those are two tests that I would highly recommend you get if you don't know and you are having some of these symptoms. So just check and find out if that's the case, because then you'll know, and then you can kind of make sure you're doing what you need to get things flowing better. Insulin resistance I mentioned before, and that is where your cells are blocked and they're not allowing for glycogen, like the glucose and stuff, to feed them. There's a block there. And usually that happens when blood sugar gets too high. Liver can be involved in that. The pancreas, your spleen, your digestive system. There's so many areas that can be involved when you have insulin resistance. And that's something where you really do have to change the way you're eating. And eliminating those too much starchy foods, definitely getting rid of processed foods. And I'll talk about this more next time, but it's always nice to kind of get prepared now of things you need to get rid of in your diet so you can make things right, flow better, eliminate pain, even if you're not trying to get pregnant. You don't want to have that pain every time things come around. And also insulin resistance is the precursor to diabetes, which you also don't want to go in that direction. And it's a test that you can get done with your doctor. They should be able to do what's called an HA1C or hemoglobin A1C. And that's checking for insulin resistance. It's an insulin marker. And so when it starts getting too high, that's when you're like, okay, I've got to start making some changes dietarily. Okay, so that's insulin resistance. Just two more. Uterine endothelial dysfunction. And that is basically a test, a marker that you can check, ADMA. It's asymmetric dimethylarginine. And that marker can tell you whether you have this type of endothelial dysfunction. And it's basically causes pain because it's increasing the contractions in the blood vessels. And so anytime you're getting like serious contractions in there, it can definitely cause discomfort. And so if that's something that you're having, you can always have a blood test to check what your markers are. There's other inflammatory markers your doctor can also check. And then lastly, the overall hormonal imbalance that can take place. And so we're looking at higher androgen levels, which also is something that you can test when you're looking at hormones in blood work. Or if you're getting urine testing, there's definitely a lot of different tests you can get now just to see what's elevated, right? But the increased androgens can definitely lead to more pain occurring. And so when I talk about supplements and dietary stuff next week, there still is a lot that overlaps no matter what kind of problems you're having with a PCOS. But there's going to be some areas where you may differ from somebody else with PCOS. Your symptoms may be different. You may not have a lot of pain. Someone else may. And so you want to make sure that whatever you do, you're being really consistent with it and trying to make an effort where you're not waiting until things get really bad, especially when you are trying to conceive. The sooner you can change your diet, the sooner you can be doing supplementation and really taking care of yourself, the sooner you're going to notice a difference, okay? And what I did want to say, though, is next time I will be talking more about the food and supplemental aspects and what you can look for, what can work really well. And lastly is subscribe with me if you want to get more fertility tips. I hope you have a great day and that you found some good information here.